I'm going to be Ellen Davis's nurse today. I'm going to look at the MAR. She's going to be given Vaseline, sodium, 1 gram, piggyback, and 50 mLs over 30 minutes, and sodium chloride, 500 mLs, 125 mLs per hour, using a 10-drop set. Okay, so I'm going to wash my hands. When I introduce myself to the patient, my name is Melissa. I'm going to be your nurse today. Verify her allergies. Are you allergic to anything? She's only allergic to pollen. I'm looking. She's only allergic to pollen. Okay, perform hand hygiene. I wash my hands. Make sure I have all my supplies ready, and I do. Maintain privacy for me and my patient. I'm going to check expiration date. I'm going to check the sodium chloride, 500 ml, no floaties, clear. Expiration date is good. I'm going to check my 50, my Vaseline. Okay. It's not expired. It's clear. My drop sets are not expired. Perform hand hygiene. Concentration is going to be 0.9% sodium chloride it's in a 50 ml bag. And 0.9% sodium chloride. I'm going to identify the patient. Make sure I have the correct patient. Ellen Davis, birth date is 9/1965. Ellen Davis, 9/1965. Maintain aseptic technique when opening sterile package. We're going to open the 500 ml first. Okay, still clear, not expired. Going to open up the primary tubing. Fill it halfway. Shut the clamp. Get all the air bubbles out. Now I'm actually using a 15 drop set, even though our orders call for a 10 drop set. Okay, got all the air bubbles out. I'm going to make sure that the IV is patent. Wash my hands, wear gloves. It is patent. Okay, I get blood flow. Okay, take my gloves off, put new gloves on. Going to attach this to the patient. I'm going to clean the hub vigorously. Going to attach it. Okay. So, if this was actually a 10 drop set, I would be administering 21 drops a minute. But since this is actually a 15 drop set, it's going to be 31 drops a minute. So it will be a drop every 2 seconds. Okay, I'm going to start counting. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30, 31. Okay, I'm going to administer that to the patient. Check for any adverse reactions. I'm going to clean my hands again. Going to check the next medication, which is Vaseline, 50 and 50 mLs. It's not expired. Okay. Now I'm supposed to use your mouth, but I don't have scissors right here. I would not do that. Okay, finally opened. My hands are very slimy, so it was very hard to open. Okay, the sodium chloride, well, the Vaseline 50 mLs. Expiration date's good. No floaties. Gonna get my secondary IV set. Put it right on there. Gonna make sure the clamp is closed. And everything is sterile. I'm gonna fill it up halfway. Make sure, open it up, make sure I don't have any air bubbles, and make sure I save the medication. Don't want to waste it. Okay. Gonna wash my hands, put on gloves, clean the Y excess vigorously. Actually, I'm gonna do the one that's higher up. Clean it vigorously. Okay. Oh, I've also shut off my primary line. It's completely off. Okay, so both my lines are off. I'm going to do my drug calculation. Now, if this was a 10-drop set, I would give 17 drops a minute, but this is actually a 15-drop set, so it's going to be 25 drops a minute. And if I round, it'll be a drop every 2 seconds. So I'm going to make sure I open up the secondary line, fully open. I mean the secondary line, yes. It's going to be fully open. And then I'm going to control the drip rate using my primary lines. I'm going to open it slowly. It should be 1 drop every 2 seconds. 1,000, 2,000. Okay. So I'm going to start counting. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25. Okay? Just gonna let that administer patient, check for any adverse reactions, and record in my mark.